EM board bombs.
Welcome back to EM Board Bombs with your co-host, co-founder, Blake Briggs, and accompanied by the amazing, the incredible Dr. Marlena Wasiski-Kuhn.
Hello.
Cue the claps. Cue the applause. Joining us in 2025, Dr. Wasiski-Kuhn is back on the team, as usual. Dr. Hussein will not be joining us today. We all know where he is.
Yeah. Goes without saying. We don't talk about it.
Because that's saying he's just doing Hussein things, not able to participate. Hey, we got some awesome stuff here at EM Board Bombs coming up. Remember that we're the podcast that for less than 15 minutes, we tell you what you need to know for the boards as well as real life. It's pretty epic. Hashtag EM Life. Find us on all the socials. Dr. Wasiski-Kuhn is responsible for all that and for our growing empire.
That's right. We're on Threads.
All over the social media waves. We're on Threads. I know, isn't that crazy? We're on Threads too. We're on TikTok. Hashtag RIP. But maybe not, actually. All the drama.
It's here. It's gone. It's back again.
We don't know. Anyway, I made a joke last week and it was gone. But anyway, we might still be back, folks. And of course, we're on the YouTubes. A crazy amount of referrals from YouTube recently. Insane. Just in 3 weeks alone, we've had over I think 700 people just from YouTube alone come and join us. So pretty epic. Remember, we're EM Rap Bombs, our rapid podcast that we do to cover amazing amount of board information, multiple choice questions, less than 4 minutes, coaching. Really perfect for the upcoming, what's coming up?
The ITE.
Yeah, awkward if you weren't ready for that one.
If you didn't know, you're about to have to take that in a couple months. So maybe start studying.
Yeah, probably a good idea to study. About a month out from that now. Actually, yeah, literally like a month out from this recording. So you may want to start studying for that if you haven't yet. We've had a record number of signups this past week. I think people know that it's coming up. So check it out if you're a resident, if you're attending, season attending, or a student. Check out EM Rap Bombs as well. We got some special, exciting things planned this year. Hey, let's dive into the STEM. I'm going to read it, and then you're going to delve into this topic. This is an awesome topic you came up with, and I'm really excited to talk about pediatrics, my favorite.
You love it? I'm here for it.
I love pediatrics.
Serving it up for you.
Anyway.
Neonatal jaundice.
Thank you. It's the meal of the day.
Here we go.
Yes. Yeah, I feel like I'm a kid again, and my mother is making me meatloaf. All right, so here's a STEM here. We got a sleep-deprived mother rushing into the ED with her 3-day-old newborn, panicked about jaundice. She reports that TikTok went down for 14 hours last week, during which time she accomplished the following: learned an entirely new language, caught up on all the sleep she missed during pregnancy, and read the entire Harriet Lane textbook from front to back. The infant is exclusively breastfed and appears well. On exam, there is yellowing of the skin and sclera, but the baby otherwise is alert, active, and has good stool and urine output. The lab results show the following: total bilirubin 16, direct bilirubin 0.8. Whatever that means. That's what I would do if I was reading this question on the board.
I know, right?
The baby was born. Yeah, I'm like, okay, yeah. Where are the little arrows? Where's the range?
Why are these?
The red.
Yeah, why are these numbers
whatever.
all in the same color?
Yeah. Is that a high or low number? The baby was born full term after an uncomplicated vaginal delivery. No other concerning findings are present. What is the most appropriate next step in management? Choice A: initiating phototherapy immediately. Choice B: recommend cessation of breastfeeding and transition to formula. Sorry. Sometimes I laugh at these answer choices. It could be right, though. Sorry, I'm not trying to sway you. Choice C: provide reassurance and follow-up with the pediatrician in 24-48 hours. Choice D: obtain imaging of the head to evaluate for cephalohematoma. And choice E: evaluate for congenital infections with torch titers.
Torch, all capital.
What do we got here? What's the correct answer?
The correct answer is going to be your favorite thing to do in this case, actually, which is to C: provide reassurance and follow up
Discharge.
with the pediatrician in 48 hours. Bye.
One of my favorite things to do is discharge
I know.
patients. It's awesome.
It is so good. In and out of the room.
It's
you
rewarding.
come out to the nurse and you're like,
rewarding.
print that discharge.
The discharge, exactly. That's 2 weeks in a row. Last week we covered low back pain. That was a definite discharge for acute low back pain. with no risk factors. And we got another one here. So tell us about neonatal jaundice. And we promise you, folks, it seems that when Marlene and I get together, we have like these crazy internal medicine topics. That's just because of how brilliant
I'm not
Dr.
trying to do this,
Kuhn
I swear.
is. And she brings these brilliant topics in, and then she talks to me, and I'm like, okay, I'm going to let you know this one.
No.
So we promise you, we always distill this down to what you need
Yeah.
to know. So please don't turn off the podcast. This is not those nerdy podcasts that really go
No.
into details. So you can find that elsewhere. This is
There's
blue
no
collar.
whiteboard behind
So
me.
tell us-
I'm not
There's no whiteboards. No arrows
not
are being
doing
drawn.
that.
So tell us the details here.
So neonatal jaundice, simple things here. So you'll see it clinically when levels get above 5. You don't really need to know that for your boards, but if you feel like knowing it, you can. When you see it in a patient, just get a total and a D-Billy. Just know that you need those two things, okay? Physiologic causes of that are things like sepsis, the torch infections. If you want to look up what those are, you can. Things like toxo, rubella, etc. Hemorrhage, which in this question was reflected by the cephalohematoma, which is like a huge galeal hemorrhage, and then erythroblastosis fetalis. I think I said that right.
Ooh, a Harry Potter
Yeah,
spell.
yeah.
Another Harry Potter spell to our collection.
You're welcome, Iltifat, that we didn't have you on to say that.
Yeah, exactly.
So some easy rules here. Jaundice on day 1 is always abnormal. So if
That's really important.
So if this was like a home birth and they bring it in immediately, bad. That's always abnormal. And then increased directability is also always abnormal.
Can you pause for a second and look deeply into the camera and say those 2 rules again? And say it louder for those in the back.
On the YouTubes, this one's for you. Jaundice on day 1 is always abnormal. Increased directability is always abnormal. And you're done. That's it.
Perfect.
That's the whole podcast.
That's it.
Bye.
That's right. Podcast. Seriously, though, that's like more than most people know. So
Yeah.
perfect. Jaundice in day 1, always abnormal. Increased directability, always abnormal. Let's dive into some more details here, but I love it.
Yeah. So conjugated hyperbilirubinemia is when your D-Billy is greater than 2 or it's greater than 20% of your T-Billy. Okay. ABO incompatibility presents on day 1. And that's, what you worry about with the day 1 neonatal jaundice. That's usually going to need phototherapy. The congenital infections that we mentioned earlier, torch, rubella, toxo, CMV, those can prevent from day 1 to week 1. And then we talked about the excessive bruising from birth trauma. The one that you'll probably see on your boards is the cephalohematoma. It's like big. You'll notice it. Vaginal birth, you're not really going to see that in a C-section. C-section babies always have those beautiful little heads, round shaped.
Cephaloid, if you will.
Cephaloid, yeah. So why don't you tell us about physiologic jaundice, Dr. Briggs?
Sure, yeah, hand it off the
Yeah.
torch here. Something easy here. So physiologic jaundice, as the name implies, is very happy, very benign. This is days 2 through 14. Usually days 3 to 7 on the test question. Hey, anything after day 1, though. That's just what it is. What the deal is here, you have increased unconjugated bilirubin. And that's just because little baby liver can't keep up. And the little baby liver is learning how to conjugate bilirubin. So this whole kind of this is not the right word here, not scientific, but the undigested, if you will, bilirubin is just floating around, yet to be processed by the liver. It builds up, and then boom, there's a lot of it. This is by far the most common cause of neonatal jaundice. So if the test question asks you, what is the most common cause of neonatal jaundice? It is physiologic jaundice. And this occurs in like literally 60% of newborns during that first week. So that's how common this is. This is by far the most common reason babies are getting phototherapy is from physiologic jaundice. Now, there's another one that's very related to this, and I feel like test questions love trying to trick you back and forth on this, which is this breast milk jaundice. And there's also this breastfeeding jaundice. Why don't you talk about the difference between those two?
So breast milk jaundice is going to be a little bit before breastfeeding jaundice. So breast milk jaundice is like days 4 to 7. The infant is going to be really well appearing. It's going to be indirect hyperbilirubinemia. The neonate is going to be exclusively breastfed, and it's due to some progesterone metabolite. You don't really need to know that. They're not going to ask about it. You should rule out other identifiable causes, but this is totally benign. You don't need to tell them to stop breastfeeding unless the levels are like super, super high, like above 20. But again, like you don't need to tell them to stop breastfeeding. Okay. Breast milk jaundice. That's what that was. So that's first. After that is breastfeeding jaundice. So that is due to suboptimal intake. So breast milk is when they're taking milk. Breastfeeding is when they're not feeding. I don't know. You can think of some other better way to remember that.
I'm trying to think. I'm trying to go with this here. Hopefully, subscriber thinks of this better. Milk is a shorter word, therefore it occurs first.
There you go. That sounds good. Yeah.
Feeding occurs after.
Yeah. Milk has
4 letters. It occurs at day 4. Feeding has 7 letters. Day 7. There
awesome.
we go. That's it.
You're welcome. That was on the fly, by the way.
That was crazy. The folks at EM Board Bombs.
So good at this.
All right, keep going.
All right,
keep
so
going.
breastfeeding jaundice, suboptimal intake, around day 7, 7 letters, 7 days. This patient in the stem, they're going to have clues like the patient has decreased stool output, poor intake, poor weight gain, or even weight loss, some kind of hypovolemia on exam, or some kind of lactation failure, like poor latching. Mom's going to give you some kind of clue like that. So that is breastfeeding jaundice. Okay, that'll be different. In that one, you're going to want to choose some kind of, supplementation. Give them some formula while they're learning how to breastfeed.
Yeah. What's the treatment pretty much for all of these? Let's be real. What does the test want you to do?
Phototherapy.
Put them under a light.
Yeah.
Yes. Questions that want you to choose phototherapy will give you some type of history of a 3-day-old infant with levels greater than 20. But you really need to use this curve in real life. But that's never going to be tested on. You don't have to memorize that either, but just don't worry about that. Essentially what happens here is if you have really severe neonatal jaundice developing here, levels like greater than 25, why this matters so much is what? Like, what's the big deal here that happens?
Oh, yes. You may remember this, like, neurologic dysfunction, kernicterus. Also sounds kind of like a Harry Potter word. Kernicterus. It's a neurologic...
Sounds like Voldemort. Voldemort's cousin or something. Yeah.
So it's a neurologic complication of hyperbilirubinemia. It's going to manifest like poor feeding, lethargy. The infant has like poor tone. I think that's like a one that is commonly used in question stems. Hyperreflexia and seizures. It's permanent, so it's very bad. So that's what you're trying to prevent. And that's because bilirubin crosses the blood-brain barrier.
Bingo. Which is permanent, right?
Yeah.
So scary stuff, kernicterus. Hey, cool story here. Do you know how phototherapy developed? So it was a nun. Of course it was.
Nice. And
there's this lady, I had to look up her name a second ago because I forgot her name, but I remember reading about the story when I was like a medical student. I learned about this on my like rotation in the NICU. This woman named Sister Jean Ward. And she was this nun that, of course, back then nuns always apparently took care of neonates and something out of a movie. And she noticed that the babies in the NICU that had this jaundice, she noticed that the babies that were closer to the window and they got hit by the sunlight every day seemed to recover faster. And so she started rotating the babies more through the sunlight. And, this is a long time ago. And she was in England, apparently, doing this. And she thought, that's weird. And she did some experiments and did her own studies and then noticed that the babies that were in the sunlight for a longer period of time had a shorter stay in the NICU and they recovered faster.
Wow.
Pretty epic.
That is cool. And I'm also impressed that there was any sunlight in England at all, actually. That's crazy. Impressive.
All right. So, hey, shout out to our only sponsor, EM News. Someone came up to me the other day and said, how many sponsors you guys turn away? You only have EM News. And I'm like, yeah, we're very selective. And check out EM Rapid Bombs again, especially upcoming in-service training exam. You got anything else?
Good luck to everyone that got their board assignments today for your oral boards. We did a oral boards case. Dr. Briggs and I did one. If you'd like to see more of those or if you found that helpful, let us know and maybe we'll think about it.
We'll definitely entertain that in the future. We got some exciting things coming this year, and I'm not just being facetious or phony. Some people messaged me in December when I hinted that we got some big stuff coming down the pipe, but we really do. Specifically for medical students, if you're listening, we promise we have some exciting things coming for you. So don't feel left out. And thanks again for following us on the socials. Where can they find us, Marlena?
At EM Board Bombs. You can find us on Twitter, Instagram,
Bingo.
Facebook, Threads, YouTube.
Yeah. We're on Reddit. People talk about us on Reddit. It's
TikTok,
crazy.
We're everywhere.
We're Reddit gold. And TikTok if it's legal. All right. We'll catch you next time.